as far as how the location of the tumor within a brain influences how difficult it can be for us as a surgeon or for the patient, different areas of the brain, as you know, have different functions or control different functions. And areas of the brain which control vital functions, I kind of refer to those areas as vital real estate. Those areas of the brain is referred to as eloquent cortex. So eloquent cortex means areas of the brain that control things like motor function, vision, the ability to move, to feel, things like that, language ability. And if a tumor is sitting in the middle of the area of the brain that controls your language ability, for example, then there's a higher chance that the patient may have some kind of a deficit in their ability to process language following the surgery. Now, that doesn't mean they necessarily just can't speak. Language has multiple components: the ability to understand what people say, the ability to say what you want to say, to read, to write, things like that. So patients can develop problems in these functions postoperatively if the tumor is in an area that controls one of these vital functions. Along the base of the skull, for example, is another area where a tumor can be very difficult to get to. The base of the skull, meaning down where the brain sits on the base of the skull, there's three different areas of the skull base, and they all carry their own problems, whether in approach on how to get to them or in terms of the functions that they subserve and the various anatomy around these areas that can lead to or increase the risk of certain complications.